Hello guys, welcome to my channel. Today I am going to discuss the topic tympanic membrane. Firstly, we start with the introduction. Normally, the normal color of the tympanic membrane is pearly white or also called as gray or it is translucent. So, the normal color of the tympanic membrane is pearly white and it is a translucent structure. It forms a partition between the external auditory canal and the middle ear. See, it is present in between the external auditory canal and the middle ear. Tympanic membrane can be affected in any conditions in both external and middle ear. See, as this is forming a partition between the external auditory canal and the middle ear. So, any pathology of the external auditory canal and middle ear can cause a damage to this tympanic membrane. And the total surface area of the tympanic membrane is 90 mm square. And in 19 mm square, the effective vibratory surface area is 55 mm square. Okay, now next, see, as this is pinna, external auditory canal, tympanic membrane, and this is the middle ear. And I think you all know these are the ear ossicles like malleus, incus, and stapes. See, tympanic membrane is at an angle of 55 degrees from horizontal surface. So it is inclined. If this is an external auditory canal, it is inclined at a 55 degrees angle. Now parts of tympanic membrane. It has two parts, pars tensa and pars flaccida. And pars flaccida is also known as Sharpnell's membrane. Now we will discuss about pars tensa. Pars tensa forms most of the tympanic membrane. Its periphery thickened to form a fibrocartilaginous ring called as annulus or thick rim. Fits tightly into a tympanic depression or sulcus. See, this is pars tensa and it gets thickened in the periphery to form a annulus. Annulus and it gets fit into the tympanic sulcus or depression. So this part is known as annulus, this part, the peripheral one. And the center part of the pars tensa is tented inwards and it's called as umbo. So this is pars tensa and the center part is tented and this is known as umbo. Now comes to pars flaccida. This is known as pars flaccida and situated above the lateral pores of malleus and between malleolar folds. See, these are the malleolar folds. This is posterior malleolar fold and this is anterior malleolar fold and this is our pars flaccida, also known as Sharpnell's membrane. Now I would like to discuss about this structure. This is a rough diagram about the tympanic membrane. See, this is pars flaccida, this is pars tensa, and this is the handle of malleus. And I already told you about this pars tensa, and this is the cone of light, and this cone of light is present in the anterior inferior quadrant, and this is posterior malleolar fold and anterior malleolar folds. Now I would like to explain you how to identify whether the tympanic membrane is belong to right or left ear. See, just draw a line along this handle of malleus. This is the handle of malleus. Draw a line along with it and draw a perpendicular line and now the tympanic membrane is divided into 4 quadrants. This is known as anterior superior quadrant, anterior inferior quadrant, posterior superior quadrant and posterior inferior quadrant. Now I would like to explain you how to identify whether this tympanic membrane belong to right or left ear. See, handle of malleus points towards the same side of the ear and it points anteriorly. See, in this diagram, the handle of malleus is pointing towards the right side, say this side. So, this belongs to right ear. And this hand is always pointing to anterior. So, the side is right and always points to the anterior. So, this is anterior superior, anterior inferior. Cone of light is present in the anterior inferior quadrant. I already told you this is anterior superior, anterior inferior, posterior superior, and posterior inferior, and cone of light is present in this anterior inferior, up to this anterior inferior quadrant. Now cone of light is present in anterior inferior quadrant. So direction of handle of Melius determines whether it is right or left tympanic membrane, and direction of handle of Melius directs always to the anterior part of tympanic membrane. See, this is right and this is left. This is left and this is right. See here, you can see always direct towards the side of the ear, right side, and this is anterior. So we can draw a diagram, and I can see the cone of light. It is present in the anterior inferior quadrant and same as the left. Now I think it's easy for you guys to determine like the side of the tympanic membrane. Thank you.